Hello and welcome. We're so glad that you've joined us today. This installment is part of a series that we've been doing on NPA's recommendations for the psychosocial support of NICU parents. These were guidelines that were published and had several areas of emphasis and domains within it. And today we're going to be talking about palliative and bereavement care. So today what we'll be talking about again is what are the recommendations for palliative and bereavement care in the NICU, and what we really advocate for is a family-centered, family-integrated model. We invite you to go and look at the recommendations that were published in the Journal of Perinatology. These were published as a special supplement, and the wonderful thing about this is that it is all open access, so you do not need a university or institutional password to read these articles. These are available for anybody who might be interested in the topic or who could benefit from it. So we hope that you go and look at the recommendations and look at the different areas that we've discussed, and feel free to share this as a resource as you advocate for this sort of care in your NICU. The recommendations cover these 6 domains: family-centered developmental care, peer-to-peer support, the role of mental health professionals in the NICU, discharge planning, NICU staff education. But today our emphasis is going to be again on palliative and bereavement care. And I want to emphasize to you too that the wonderful thing about these guidelines is that they're interdisciplinary recommendations. We know that in order to provide care for an infant and for a family, we require a broad and a diverse team of professionals and paraprofessionals and advocates. And these guidelines are written with that in mind, so that they don't just cover one silo or one sector, but they show how truly to use your whole team and to have a collaborative approach to supporting families. These are our objectives for today. We're going to talk about the why and the how. So we'll talk about the rationale for why these were included in the recommendations, why they're important, and why these interventions were considered fundamental to psychosocial support. We'll talk about how both NICU staff and peer mentors and parent advocates can support these recommendations, and what resources are available to us as we try to improve care. I'm your host, Erica Goyer, and joining me today, my co-host, is Kira Sorrells, who is the president and founder of the Preemie Parent Alliance. I'm with the National Perinatal Association, which is a nonprofit organization and professional organization that's dedicated to interdisciplinary collaboration in the perinatal realm. Our presenters who are with us today are Dr. Carole Kenner and also Tracy Pella. So Tracy Pella is a parent and an advocate. She is now a board member of the Preemie Parent Alliance, one of the organizations that co-hosts this webinar series. Tracy is also the founder and president of Connected Forever, which is a nonprofit organization based in Nebraska that came out of her and her family's experiences with their own perinatal losses. Tracy's the mom to 23-week-old twins. She has 1 angel baby and 1 survivor, and also a 37-week-old daughter and a 34-week daughter. So she has much experience with the care that is delivered in the NICU setting. Dr. Carole Kenner is the dean and professor at the College of New Jersey in nursing. She's also the founder and president of the Council of International Neonatal Nurses, also called COIN. She has dedicated her life to improving care for babies and families in the NICU. And one of the things that was especially compelling for her in her career is that she realized early on that while it was so necessary to have palliative and bereavement care services in our NICUs and our labor delivery units, there was not necessarily much guidance. And so she has dedicated herself to understanding the needs of families and parents, understanding the important principles of palliative and bereavement care, and being able to adapt those best practices into the NICU setting. She's also a much sought after speaker and has years of experience in teaching, including the publication of many journal articles and contribution to several textbooks. So as we begin this discussion, I think it's useful for us to talk about, just generally speaking, what is palliative and bereavement care? Dr. Kenner, can you tell us a little bit about how you describe it to people?
Yes, palliative care to me is comfort care. It's what every baby and every family wants their baby to achieve and receive in the neonatal intensive care unit. Every baby that is in a neonatal intensive care unit has a potentially life-threatening disease or is born very prematurely by virtue of being in a NICU. So the comfort care helps with that NICU stay. Bereavement care, well, oftentimes we think about it being after a child or after a family member dies. Reality is, for some parents, they've said to me, this starts as they see their child actively dying than the baby. So the bereavement care is really that support that happens when a death is imminent and then can continue for months or years after the death.
Right, and when you said that, that made me think about something else too, is that sometimes, I mean, more and more as we have diagnostic tools prenatally, sometimes that bereavement even begins before the baby is born.
Yes. Yeah, perinatal palliative care and bereavement care, we usually call it palliative care, can start during the pregnancy, especially if you know that the baby may be born dying or may not be alive at birth. And so you do start these kinds of care or type of care prior to the delivery.
So I know we don't expect you to be able to tell us everything that the recommendations say. We hope people will take the opportunity to go in and read the publications. But can you tell us a little bit about how you would describe the recommendations, and also why was it so fundamentally important that this domain was included in the recommendations for psychosocial support?
I think it's critical because it's a critical part of care, especially in the neonatal intensive care. Um, from my own experience, I remember being a new nurse who had never lost a family member, and here I'm suddenly working with families that are facing a death of a baby, and didn't have a lot of guidance, quite frankly. And yet we did the best we could, and we asked families what they wanted. But for us as health professionals, there were no real guidance, no real recommendations. And we also recognized early on in my career, and we being the team, doctors, nurses, specialists, clergy, working together, that it was important that we talk to each other as a dedicated team and had a team approach. So when these recommendations were beginning to formulate, it was very clear that it was a stressful period for parents, but it was also stressful for health professionals, especially those that really had never even experienced a death themselves, to know how to approach families and how to really provide the support that families needed and that health professionals wanted to give. So I think we all went into these recommendations saying that if we're going to provide family-centered developmental care, that palliative care, bereavement care, was an essential component, yet one that's often overlooked in terms of recommendations. Palliative care and bereavement care is still not considered a standard of care. It is an add-on in many cases. I don't feel that way, but it's not what we talk about as prominently as talking about how we care for a respiratory illness or a heart problem. It requires a disciplinary approach. It is stressful, and it really needs to cross all kinds of settings. So some of it may be in an OB setting, in a perinatal setting, because the baby is recognized in utero as having a life-threatening or potentially life-threatening event. So it's really critical that this becomes a standard of care, which it has not been.
Thank you. We appreciate those insights.
Tracy, during your introduction, Erica mentioned that you lost one of your twins. So I'm assuming that that is pretty um, indicative of why this particular topic has been important to you and why you became a part of the project. Can you talk to us a little bit about that?
Yeah, definitely losing our son has made this topic even closer to our hearts. It was nearly 8 years ago that our twins were born at just 23 weeks gestation. Their birth was very traumatic. It was very sudden. We actually had no previous knowledge that it would happen. We were at a doctor's appointment, and within literally a few minutes, I was on the surgical table having a C-section, and our 23-week, 4-day-old twins were born. And so never thinking about having micro preemies, let alone losing one of our sons. And that was our introduction to parenthood. And so really learning that side of bereavement and the care that's provided in the NICU, along with we developed a nonprofit organization almost 5 years ago, and seeing that work firsthand on the other side of the care has really made the topic even more important for our family.
And so you mentioned the work that you're doing with families right now, providing support in the NICU for families who have a premature baby, a baby born with medical complications, or if they have an experience similar to you where they lose one of their babies. So tell me about how the recommendations that were published, how has that been able to support the work that you do with Connected Forever in the hospital setting with providers and with parents?
Yeah, so it's really allowed us to advocate, to build awareness around the need for peer support for families. That peer support of providing a veteran, NICU or bereaved parent to walk their journey alongside a bereaved parent. So the guidelines have allowed us to, build that collaboration with hospitals to allow us to, to be part of that family-centered practice and to work alongside the NICU and bereavement staff on the hospital side of things, to really be, seen as a team member to provide that care for families.
So now we want to talk about what the recommendations say, but more importantly, how they can be used within a unit. What are the things that can actually be done? What are the things that can help support a family who is going through either a unexpected medical crisis or the imminent death of a baby? So Dr. Kenner, can you tell us a little bit about some of these components that you think are so important for staff and families as they're facing these sorts of dilemmas?
I think, first of all, this is a partnership, and that health professionals need to work with the families and find out what they want. Some families have said that, we've never had the baby at home, never been integrated into the home environment like they had anticipated. And so being able to provide a room and privacy is important to them. Being involved in bringing their family members or siblings of the baby to the hospital so that they have that environment and are allowed as a family to unite. I think that's important, and for health professionals to recognize that that's not the comfort zone of some families, but it is of others. And so really partnering with the families, what is it that you need? What can I do for you? Anticipating that the families may not understand how the death may occur. What I mean by that is that I have worked with families sometimes and said, this is what the baby's going through right now, just so that they can anticipate it and they're not so afraid, especially if we have siblings there, that for the most part, depending on their age, the fear is not with the siblings because we teach them fear. It's the fear of how the child will react to a dying baby when in fact they see the baby as their brother or sister, again, depending on the age, but
Yeah.
anticipating what the family may not be able to tell you that they're thinking, or questions that they have about what's happening. And you can take cues from them, and should take cues from them about what it is they need or what they want. Encouraging them, if they want to hold and touch the baby. They're not going to harm the baby. Dressing the baby in normal clothes instead of in what we might have in the hospital, so that if they want, and not all families do and not all cultures do, want pictures of the baby actually dressed in baby clothes, or in a more normal environment. That's the partnership that's important, to create the memories with the family, with their, if they can, if they feel that they want to be able to tell you. And I say that because I have had a couple of families that just absolutely could not articulate what they needed. They just needed you to be there with them, to support them, to be quiet with them, not to be alone, or to be alone, depending on what their comfort was. But really taking those interventions to personalize it to that family and that family's need and that baby. But I've had so many mothers say, in particular, say to me, why couldn't you have dressed my baby? Would it have hurt? The baby was dying. I needed to see the baby as I had envisioned the baby going home.
No, I think these insights are so important. I'll share for a moment some of my own experience. I think one of the things that's so powerful about all of these interventions is that, like you alluded to, they restore what it was that the parent role that you anticipated was, and allow you to parent your baby now on what are very different circumstances that you anticipated. I know, for example, when you were talking about it, I thought about how when my spouse went to be with our baby in the NICU, the nurses offered wonderful anticipatory guidance about what the death process looked like and what was going on and what it meant, the way the baby was breathing or feeling. And then I think about my own experience, where I didn't get to spend time with my infant until after Carrick had died. And the time that I spent with him privately, dressing him and talking to him and being with him and taking photographs, were something that I think allowed this sort of death to be a good death, and not to be something that was a real loss. And I think it's so fundamentally important that staff and families get to have these experiences, and that we create an environment in which it's okay for these things to happen.
Mm-hmm.
I can't emphasize enough, and I think it is important for us to emphasize just how important that anticipatory guidance is. And I know Tracy has some comments about that. I too lost a child. She was a micropreemie, but passed away when she was a year old in the PICU. And at the time of her death, her neonatologist from the hospital across the street was with us, as was the peer mentor. And they did such a wonderful job with us in helping us, because we were not expecting her to die. It was quite sudden, but I wouldn't have known that I could give her a bath had they not suggested it. I wouldn't have known that I could put a onesie on her had they not suggested it. So I'd love to hear from you, Tracy, about any of your personal experience that you wish to share with your son, and what do you think is most important for staff to know during this time for families?
Yeah, excuse me. When I really look back at our experience, it was such a state of shock. And I look back at the memories that we have and the things that we have, and a lot of those were suggestions by, either the NICU staff or, the labor and delivery staff. And And what I recall is I remember often saying like, well, what do other people do? You know, I remember them saying like, do you want to keep him in your room overnight? And I remember saying, well, what do other people do? And not really fully understanding, you know, it wasn't that I wanted to do what everyone else was doing, but I needed to know, you know, what should I be doing or what is okay to do? You know, a lot of you have already mentioned like giving a bath or dressing, you know, and at the time, not realizing that those, you know, almost 72 hours were, you know, the only time that we had with our child forever. And so, you know, I didn't realize the significance of those at the time. You know, but looking back now, you know, I can, you know, still so vividly remember his smell, his touch, all of those things. And those are memories, you know, those are the only memories that we have of our son. And another one that really sticks out in our mind is that our twins, obviously we had a survivor. And so our son Cohen that passed away, they were put together in the isolette for a very, very short amount of time after Cohen passed away. And I mean, my husband was actually not even at the delivery when the boys were born because he wasn't at that appointment with me and it happened so quickly. And so when our boys were put together, you know, we didn't think to take pictures of them. You know, no one, all of our family was there. There was probably, you know, by that time, 15 to 20 members of our family gathered in the NICU. And no one thought to take a picture until it was about a month after we found a disposable camera. And we found, you know, we were able to develop that and find, honestly, 2 pictures of our twins together. The flash was never turned on. And so, you know, by whatever reason or whatever sign, 2 of those pictures came out. And those are the only 2 pictures that we have of our sons close together after they were born. And so if someone hadn't taken the time to give us that camera or to take those pictures, those memories wouldn't be available for us. So those are kind of some of the big things is really realizing that most, you know, or a lot of families that are experiencing this are in a state of shock. This isn't something, you know, maybe even if we were, you know, given some time to think about it or prepare, you know, we truly just lost our child. And so we're not always, you know, able to really make those decisions without some guidance. And so that's often appreciated while also allowing us to make those decisions for what's right for our family and our beliefs.
One of the things that that I just wanted to mention too, because you did have a survivor, and I also had survivors, is after Cohen passed, how well did the NICU staff support you afterwards? Did they talk about Cohen, or was your survivor automatically a singleton now? Because I know for me, again, my girls were far out of the NICU by the time my daughters died, but it was very important to me at the time for them to still be acknowledged as triplets.
Yeah, the NICU staff did a phenomenal job of always recognizing Cohen and really, you know, making him part of our family. So we, you know, were allowed to keep items in Cooper's room that were Cohen's and really thinking about them, you know, as twins. You know, but there were some things that were maybe a little bit out of their control. You know, it was some things that we had to grieve and think about differently, you know, when there was twins next door or, you know, different things that would come up, you know, in a lot of the paperwork, it was still, you know, twin A and twin B. And so seeing a lot of those reminders were things that, you know, the staff did a great job to do the best that they could do, but there was always things that, you know, kind of come up throughout that experience. And our NICU stay was, you know, almost 5 months. And so a lot of those things really came up, especially as we went home and understanding that grieving process continued. And so the NICU staff did a great job of really understanding that. And, you know, even if something came up, really holding that space for us and understanding that, you know, we needed some time to grieve and really talk through that and knowing what our family needed as a whole.
Wonderful. I'm so glad that you had that you know, supportive team for you throughout the rest of your stay. So let's move on to the next slide. So Dr. Kenner, what if our listeners can take just two things away from this webinar, what do you think are the most important things for them to remember?
That palliative care is just an essential part of neonatal care. It's not an add-on or an added value. It's essential core to what we do. And that it's a partnership. It's a partnership with each and every family, because each and every family reacts and responds, and their needs are different. And if we don't include them as part of the healthcare team as much as they want to be, and I say that because, again, some families are so much in shock that they can't articulate what they want and need. And then based on our experience, we need to support that. But others need to know that they have a voice and are a partner in doing as much or as little of the care, of being involved in the decisions, of being an informed decision maker in the care process. I think that's critical.
Thank you. And Tracy, what about you? If we have other peer mentors or NICU parent leaders who are listening, what do you most want them to remember as they build and strengthen their support programs?
So really understanding that, all families grieve differently, if it be, culture or religious beliefs, different things like that, we all grieve differently. Males and females, grieve differently, and really understanding and meeting families where they are, providing them resources and support, in the hospital, but also after they transition home. And then really understanding that hospital policies and different things, guidelines within the hospital can really create some barriers to providing the support within the guidelines and some of that best practice support for peer mentorships and walking alongside families during their bereavement journeys. And really understanding that we need to be that voice to advocate for families and to continue to build those relationships and collaborate with hospitals so that we can provide the support that we know families need and could benefit from.
Thank you for that. And as we near the end of our webinar, care is always evolving. And I'm wondering if there was one thing that you would add to the existing guidelines, what might that be? I'll start with you, Dr. Kenner.
I don't think it's as much adding to the existing guidelines as realizing that many hospitals, especially smaller hospitals, don't have the resources available or don't have a palliative care team and people that are really trained and educated in this type of care. So knowing and expanding the resources that we have available that we can give through the parent groups, through healthcare professional organizations, and others such as the NPA, that's critical. And I think that we have to recognize that this is an evolving field, an evolving area, and that the dialogue, since those guidelines were published, recommendations have been published, has really grown. And I think that we need to continue to learn together at how we can provide care, better care, and more integrative care.
Thank you. What about you, Tracy? What are your hopes for the evolution of palliative and bereavement care? Before you answer that, though, I do just want to comment on what you just said, Dr. Kenner, because even since it's been 11 years since my daughter passed, and in those 11 years, there is much more public conversation about losing a child, whether that's miscarriage, stillbirth, neonatal infant death. And so, having the provider voice coupled with the parent experience voice and really, bringing that to the forefront. I mean, it's making a difference. And it's wonderful to have these guidelines to back us up as well. So Tracy, what about you? Do you have hopes for palliative and bereavement care?
I think one of my biggest hopes is really finding a way to bridge and bring together the hospital and NICU bereavement and palliative care with after families go home. And I think that that's something that we are seeing a lot with the families that we support is, I mean, some families are in that hospital setting and receiving that care for less than 24 hours. And so that might be, you know, the best care that's ever possible provided to them. But then unfortunately they walk out of those hospital doors and they're in a whole new world of living their life without their child. Those hopes and dreams, you know, are not what they thought they would be. And so how do we bridge that, that care from the hospital to when families go home? You know, I know Dr. Kenner mentioned earlier, I mean, it can be months and, you know, up to a year or longer that those families are grieving and needing that bereavement care. So how do we provide that after they leave the hospital doors?
Very, very good point.
Well, before we conclude, I just want to thank you all so much, you know, Carole and Tracy and Kira too, about this has been such a sensitive and smart discussion of the issues around palliative and bereavement care. And I so appreciate your time and your contributions, and also just the work that you've done over your lifetime and continue to do to improve this sort of care. Thank you very, very much. As we conclude, we want to point you to some of the resources that we've talked about during this presentation. Connected Forever is a fantastic organization, and Tracy is such a thoughtful voice and leader within that organization, along with her family and her colleagues, promoting care. And so we invite you to go and see what that care can look like and what it can look like after families have left the hospital and are back in the community. We also invite you to learn more about the National Perinatal Association and one of our partners in presenting these webinars to you. National Perinatal Association is a interdisciplinary group of parents and providers and advocates, all advocating for better perinatal care. And we, again, were honored to have the opportunity to convene these groups and to create these recommendations. The Preemie Parent Alliance is a essential, much needed organization. Kira is the founder and president of that organization, and it brings together families and parent advocates and helps them develop both professionally and personally so that they can work within their communities and grow our communities so that we improve care. Some of the resources that go along with these series can also be found on Support for NICU Parents. This is a companion website that was created to go along with the interdisciplinary recommendations. And while the recommendations in so many ways provide a foundation of evidence and rationale and to the broader academic medical community, what has been done on Support for NICU Parents is that information has been taken and turned into action. So if you're interested in implementing these recommendations, you will find tools and guidance and support to be able to do that. And finally, My NICU Network is a collaboration that also came out of these recommendations. It is parents and providers working together to discuss how, again, we take these recommendations and we educate staff how to best implement them. There is a series of courses available at My NICU Network that covers the full breadth of the recommendations, the 6 different domains, and talk about how NICU staff can be supported in understanding and appreciating and benefiting from the implementation of recommendations that promote the psychosocial support of families. We hope that since you were with us today and listened to this webinar, you now appreciate more about what the PPA and NPA's Family Advocacy Network do. We again are collectively raising our voices and supporting each other so that we can improve the care that families experience during the perinatal period. And we are always looking for new and dynamic and exciting advocates to join us. So please, if you are at all inclined, let us know. Please reach out to us. And also following up to this presentation, please check out the companion website that we're developing. It's on the National Perinatal Association site. It's for NICU families. And there we will be compiling all the webinars, all the resources that we've talked about, transcripts from these discussions, and more resources based on the recommendations so that you can help advocate for improved care and improved psychosocial support of NICU families. Again, you will find many of these resources and more, including a preemie Bill of Rights at the Preemie Parent Alliance's website, premieparentalliance.org. Thank you so much for being with us today. Thank you for spending your time with us, for listening, and thank you for everything that you do to contribute to improvements in care. Until next time, have a good day.